Antimicrobial use, resistance, and stewardship are terms that are mentioned a lot these days, especially in food animals. Antimicrobial use drives the emergence and selection of antimicrobial-resistant bacteria. The common message is that we all need to work together to meet the challenge of antimicrobial resistance, and that means doing our part as a dairy industry. So how are we doing? The Canadian Dairy Network for Antimicrobial Stewardship and Resistance, CADNet for short, is a national surveillance program developed to measure antimicrobial use and antimicrobial resistance on Canadian dairy farms and guide antimicrobial stewardship practices. From 2019 to 2022, the research team set out to collect data on 144 dairy farms across 5 provinces. So what did they find? The most commonly used drugs were penicillins, first-generation cephalosporins, third-generation cephalosporins, and tetracyclines, though there was a high amount of variability between farms, suggesting there is an opportunity to strategically reduce use on some of these farms. Researchers analyzed fecal and bulk tank milk samples to look for the presence of foodborne pathogens. The generic non-pathogenic strain of E. coli was the most commonly found pathogen on farms. And while each pathogen showed resistance to certain types of drugs, all showed resistance to tetracycline. So what are these drugs being used for? And where might we be able to meaningfully reduce their use without compromising animal welfare? Udder health is an important target area for reducing use, as mastitis treatments and dry cow therapy are responsible for the majority of antimicrobial use on dairy farms. Selectively treating non-severe cases of clinical mastitis with antimicrobials is now a recommended practice for dairy farms, as research has shown that selective treatment protocols can be implemented without negatively affecting cure, somatic cell count, milk yield, recurrence, or culling. Farmers should work closely with their herd veterinarian to determine whether this could be an effective strategy for them. Implementing a selective dry cow therapy protocol can also reduce antimicrobial use and costs on farms, as it focuses on only treating cows with udder infections who will benefit from antimicrobials. Selective programs can be implemented without negatively affecting udder health or milk production. Once again, working in close consultation with the herd veterinarian is best practice. Criteria for selection can be implemented at the herd, cow, or quarter level and can include using SCC thresholds, clinical mastitis history, identification of bacteria involved, or a combination of criteria. The CADNet data showed selective dry cow therapy was used by 1/3 of farms. Among these farms, the percent of the herd that received antimicrobials at dry-off was approximately 50%, but this ranged from 3 to 97% of the herd. So there is an opportunity to increase the use of selective dry cow therapy on many farms. Calves are also a target area for reducing use because they are commonly treated with antimicrobials, and they have a higher proportion of resistant and multi-drug resistant bacteria than older cattle. In this study, 30% of calves were treated at least once with an antimicrobial, with most antimicrobial treatments being due to respiratory disease and diarrhea. The amount of antimicrobials used on the farm varied considerably, with a range of 0 to 88% of calves having been treated with antimicrobials. This suggests that some farms have extremely low antimicrobial use, and others have an opportunity to reduce use by implementing treatment protocols or preventative practices to improve calf health. A farm's herd veterinarian is best positioned to highlight farm-specific opportunities to meaningfully reduce antimicrobial use. Farms that fed transition milk have fewer treatments per calf. There is building evidence that highlights the importance of transition milk after colostrum feeding, as it can improve the development of the gastrointestinal tract, reduce disease, and improve growth. Therefore, feeding transition milk could act as a management practice to reduce disease and ultimately reduce antimicrobial use. Antimicrobial resistance is a global threat, and we all must do our part. CADNet has helped us to identify some of the key opportunities for dairy producers today. Consult with your herd veterinarian on how these strategies could be effectively implemented on your farm.